Hi, friend. I wanted to share with you current flu status in the US. Hi, if you're new to this channel, my name is Dr. Hawk. I'm an academic hospitalist practicing in the US. As you know, currently we are in that flu season era. December, it's holiday season. We really need to be cautious about protecting us and also protecting our loved one from flu and other respiratory illness. So during the months from usually December to February, not only flu, also COVID, RSV, those are the viruses usually get very high. So the first question is, what is the status currently? As you may already know that each year we always take a look at the southern hemisphere like country, UK, Canada, Australia. How is their flu season going? Because they get the winter and flu season much earlier than us. So usually their flu status kind of serve as marker for our flu season. As of now, UK as well as Canada, Australia, they have very high flu number. So that meaning that there is a high probability that in the US for 2025 and earlier January to February 2026, we will also have high flu rate. So, what is the current strain currently going on? The very much mutant strain is currently spreading, which is H3N2 variant called subclade K. So, this is the variant quite contagious. So, we need to be cautious because if somebody is getting infected, the chance is that they will spread more people than the other variant. One study showed that, for example, if previous for other strain, if 100 patients were getting infected, it can infect 100 patients. In contrast, this subclade K, which is quite contagious, if 100 patient is getting infected, it can make infected 140 people. So as you can see, quite infectious. So what we can do, the purpose of this video is not to scare or not to share information that will frighten us. The purpose is raise awareness. So what we can do in this situation where we can have some idea that, okay, based on UK, Australia, our flu season could be very much high. One thing we can always do, if you are surrounding any people, who have like some kind of symptoms such as fever, chills, cough, try to stay far from those people. But you may be caregiver for those patients. For that case, wear mask. And when you are taking care of that loved one who has these symptoms, make sure you are washing your hand. You can wash your hand by soap or water or thorough hand hygiene by hand sanitizer. So if you are a caregiver, I understand, we need to take care of our family who are sick. Make sure you are also not getting sick because then you will not be able to take care of your loved one. So how you can protect yourself? One, wearing mask, hand hygiene, then cleaning these surfaces. All these surfaces such as kitchen, the common kitchen area, doorknobs, the lift button, those things are used by hundreds of people every day. And those could be very common surface for having, the contagious getting all the infection can get spread. So making sure cleaning those common surfaces. What else? The study which was done in UK that showed that the current vaccine which we have this year, full disclosure, it is not perfect match, not 100% productive. The good news is that the study showed that the current vaccine has immunity to give the reduced hospitalization almost 70 to 75% for children and up to 40% for adults. You may say, okay, it's not 100%, Dr. Hawk. Yes, you are right. At the same time, if you or your loved one is sick, you want that 1% chance during that time. You want that chance that, okay, how you can reduce the severe illness, how you do not have to go to ICU. You want to reduce the hospitalization, severe illness, and death risk reduction. So, vaccine, as of now, it has shown that it reduces hospitalization, severe illness, and death. What else we can do besides mask, hand hygiene, vaccine? Be careful for those people who are vulnerable. So now question is, who are vulnerable people? Our children who are less than 5 years old, our adults family member who are more than 65, also who have any pre-existing condition like heart disease, asthma, COPD, if they got transplant, if they have cancer, if they are on any kind of medication like chemotherapy that can reduce the immune status. All those people, they are at high risk category. They are more vulnerable to get infection. You, me, anytime we can get flu or any respiratory illness. At the same time, those people who are high risk or vulnerable, they have high chance to not only get infection, also whenever they are getting infection, they are at high risk of getting severe illness, hospitalization, ICU transfer, intubation, and death. So if you have those vulnerable people in your life, be careful for that. So what other preventive measures we can do? I know that now in every channel, people are talking about vaccine, hand hygiene. Of course, they're important. At the same time, if you are in a very crowded place, and this is a holiday season, we need to travel, we need to be in holiday gathering. Those are part of life. At the same time, we need to ensure that we are safe, our family is safe. So if it is like very much crowded, you are in a bus, subway, airplane, make sure you are wearing mask. If you are very close, when you are close to other people. And also, we may often forget the importance of nutritious diet. Make sure you are eating enough protein, vitamin C, that always helpful to build that immunity that can protect us for kind of respiratory illness. Exercise, if it is very chilly outside, try to do some walking, some weightlifting, maybe 5 to 10 minutes, 2 to 3 times a week. All those small chunk of exercise will help to build your immunity. So we are coming close to the end of this video. In this video, I wanted to share all those things which is within our power to do to prevent flu, to prevent COVID, RSV, and above all, to keep us healthy and enjoy a great holiday with our loved ones. I hope you find this video useful. If you have any other comments that you feel that, okay, audience need to know during this flu season, put it in the comment section. Thank you so much for joining me today. I will see you in the next video. Until then, take care and have a wonderful time with your family. Bye-bye.